absolutely shocking, but as you've already alluded to, not that surprising if you look at the history of research integrity from the pharmaceutical industry going back many years, which I'll come on to. But I think what's interesting, and the BMJ don't do these investigations and publish them unless they're very, very thorough. And this individual, this lady's allegations have been independently verified by 2 other employees. So it's very likely that what she's saying is correct. And it's obviously very worrying, as you've already also alluded to, that it's not picked up. This should be international news, major international news. That Pfizer trial, that pivotal trial, has resulted in, because of that data, millions and millions of people have taken a vaccine. So the problem is that we are, as we have been doing for a long time in medicine, doctors, patients, clinical decisions are being made on incomplete, biased, and in many cases, potentially corrupted data. The pharmaceutical industry there, to make profit. They don't have a legal responsibility to give you the best treatment. So this is the way business is done. And unfortunately, the reason why it hasn't been tackled is because there's not been any effective interventions or sanctions that have been put on the pharmaceutical industry. If you look, this is something I've campaigned on for many, many years. I actually gave a talk in the European Parliament a few years ago called Big Food and Big Pharma Killing for Profit. That was the name of the title, question mark. And one of the things I said is between 2009, 2014, most of the top 10 pharmaceutical companies had paid fines in criminal activity of around $13 billion for hiding data on harms, illegal marketing of drugs, manipulation of results. And nothing really seems to have changed in the system. Just to give you one example, I'm quoting facts here. So GSK in 2012 paid the biggest settlement in fraud of $3 billion. For
GlaxoSmithKline.
Yes, absolutely. Yeah. But they paid $3 billion, but they made $25 billion in profit during the period covered by the settlement. Nobody got fired. Nobody was jailed. So this is business as usual for many of these companies. And I'll be very honest with you, Maajid. I took, I'm a doctor. I see patients. I've had many vaccines over the years. And I think we need to also talk about how this particular vaccine is not similar to other vaccines. We can't put them all in the same box. Is I took under the belief very early on, I was helping out in a vaccine center. I was given, I had both doses of vaccine very early on, sort of January, February time, despite the fact I'm not high risk. But I did it as a duty as a doctor under the belief, which is clearly now being proven false, that I was going to protect my patients, older people, vulnerable people from getting the infection from me. And what's now very, very clear, as this data is evolving, is that there's no significant reduction in transmission from taking the vaccine. Now, let's just also be very clear here. I'm pretty convinced that the vaccine most likely does prevent serious illness and death, and we've got some real-world data to support that. But it changes the conversation, Maajid, because we then start looking at low-risk groups and whether or not they should take the vaccine. And this also applies to mandates.
Like children, for example, like children.
To give you an example, sorry to interrupt. Yeah. Give you an example. If you took a healthy 19-year-old, okay, and this is verified, you can go online and do this calculation. There's a website where you can go and check this out. A healthy 19-year-old, the risk of dying from COVID is 1 in a million. They are significantly more likely to die from getting the flu. So we're not mandating vaccines, flu vaccines for children. Why are we mandating COVID vaccines when we also now know it doesn't stop the spread? So the whole situation is an absolute crazy mess that we're in.
May I attempt by way of a second question to answer what you alluded to at the end of this particular answer of yours, and that is because in 2018 the BMJ also published an article headlined "Drug companies are incentivized to profit, not to improve health," says report. And the article goes on in the BMJ. The BMJ's got good form on this kind of stuff, by the way. It says government funding for health innovation is subsidizing drug industry profits while providing little public health benefit, a report from leading health economists says. Most new drugs are not meeting public needs, while economic and regulatory incentives have created a, quote, highly inefficient pharmaceutical sector, which spends more on marketing than research and development, and focuses the research it does do on profits. This leads to prohibitively high prices, but also to sidelining of treatments aimed at prevention or cure in favour of drugs with long-term, high-volume sales potential. Is that possibly, from the BMJ in 2018, is that what you think's happened here in light of your answer you just gave to my previous question?
Yeah, I think so, Majid. I think the system is geared where it doesn't really protect the public from the excesses and manipulations of industry, if you like. So the regulations are poor. They're able to get away with this sort of stuff. And this has been a cycle that's been continuing for at least 2 decades. I mean, just to give you some perspective here, between 2000 and 2008, of the 667 drugs approved by the FDA in America, and obviously many of these drugs are then licensed over here, only 11% of them were found to be truly innovative, as in an improvement on the previous drug. Because what the drug companies do, they just change a few molecules here and there. They then get a patent on what seems to be a new blockbuster when it obviously isn't. We find out later on. And then a few years later, when we've realized that, they move on to the next drug and the cycle continues. So there's a lot of waste in the system as well. But I think that this is something that really needs to be tackled head on. I think the fact that this hasn't been dealt with by successive governments around the world means that we are going to continue to have this problem of incomplete data, biased information, and then ultimately not giving the best outcomes for patients, people who are trusting of their doctor. And the doctors, of course, are in the same boat because we are making clinical decisions on biased information. So the whole system really is in a complete mess. And I'm glad you raised the issue about prevention. So I was one of the first people, certainly in the mainstream as a doctor, internationally to highlight the link between what we call poor metabolic health, excess body fat, obesity, and poor outcomes from COVID-19. Now, modeling studies have suggested if we had a healthier population, possibly half of the deaths in this country would have been avoided. But that isn't the main focus of the discussion. In fact, even despite me saying this and having a few outlets on mainstream media, BBC, Sky, LBC, I've discussed this as well. We know after since the pandemic has started, and we're kind of hopefully coming out the other end now, a significant proportion of the UK population has gained weight, has gotten healthier. We're now seeing a surge in heart attacks. So actually we didn't handle this pandemic very well, in my view, and we have to think further. And in terms of the mandates, come back to the mandates issue, I think now that we know that it doesn't prevent transmission to any significant degree, this should be about informed choice. If public health officials and vaccine scientists want to, encourage more people to take the vaccine, fine, but do it through persuasion, not through coercion. We should have transparency and not censorship, because this is only going to widen the chasm of distrust. We've got 100,000 NHS employees at the moment who have not had a single dose of the vaccine because they do not trust either the public health officials or the government or even, senior scientists. So there's a big problem here. And if we mandate it, my fear is NHS is under so much strain already. Emergency care is failing. My own father died a few months ago, suffered because the ambulance didn't turn up in time to defibrillate him from a cardiac arrest. So I have had my own personal experience of this, and it's failing. And if we put more strain on the NHS by mandating in my view, completely unethical, put a complete unethical mandate, then we are going to cause a bigger problem when it comes to the NHS, and it could be even more devastating.
And yet, despite all the evidence, Dr. Malhotra, despite all the evidence that the COVID vaccines do not stop transmission and do not significantly stop transmission for the purposes that would to serve a vaccine mandate, therefore are illogical, despite all that evidence, certain quarters continue to push them. So last month from The Times, I have an article here, Astra and Pfizer go to war again in new row over COVID jab performance. Now, the first line of the article opens up, AstraZeneca accused Pfizer of spreading misinformation about its COVID-19 vaccine at the height of the UK rollout. So again, off the back of this particular thing I've just read to you, my last question to you, and thank you for joining us, is partly perhaps the reason why, despite all the evidence, certain quarters and certain voices continue to push for what I believe and what you have confirmed are illogical vaccine mandates. Is Big Pharma having an undue influence over our government through lobbying?
Absolutely. We have what we call the corporate capture of public health. And in fact, one of the things I do as someone who's interested in public health and campaigns on many issues over the years is looking at the upstream causes, going to the root, the causes of the causes. And there's something that I think a term people will get more familiar with as we move forward. It's called the commercial determinants of health, Maajid. So this is strategies and approaches adopted by the private sector to promote products and choices that are detrimental to health. That is at the root cause of our healthcare crisis, the commercial determinants of health, and the collusion between drug industry, politicians, and senior scientists for money who actually have a responsibility to public and to scientific integrity. That collusion for financial gain is at the root of the problem.